and welcome to Transforming WHO, a series of videos where I talk to colleagues about the work we do in the World Health Organization and how we transform WHO. And today I'm joined here in the studio by my very good colleague, Amelia Afuhamango Tuipulotu, who is the Chief Nursing Officer of WHO. And welcome, Amelia, in the studio. And thanks for joining.
Thank you.
First, a little bit about yourself, Amelia. You grew up in Nuku'alofa, the capital of the Kingdom of Tonga. Then you went to Australia to study nursing, returning back to the capital of Tonga to work in Viola Hospital, which I understand is the main hospital, the tertiary hospital, in the fairly small island nation of Tonga. You very quickly rose to leadership roles in Viola Hospital, managing the surgical ward, the psychiatric ward, etc. And then back to Australia, and you did a PhD, actually the first nurse in Tonga to do a PhD, and then again returning to Tonga, assuming even bigger leadership roles. You eventually became the Chief Nursing Officer of your country, and then a Minister of Health. And you served as Minister of Health from 2019 onwards, including leading the response to the COVID-19 pandemic in Tonga. And then joining WHO, first you served on the executive board, and then assuming your current role as the second Chief Nursing Officer of the WHO. Is that a fair description of your very long and distinguished career, Amelia?
Absolutely. Thank you very much. It's such an honor to be here with you.
Thank you. We have a couple of pictures. I think we'll bring up the first picture of a young Amelia in high school. There we are. And I think this is sort of in high school, then you graduated and went to nursing school in Australia. The next picture was with your family here in Geneva. Your husband and your son. In front of one of the beautiful old steamboats down here at Lake Geneva. You all dressed up as Team Tonga, huh? I don't know, what is the big sport in Tonga? I think rugby is big, isn't it?
Yes,
so that's
absolutely.
Rugby. And your husband and your sons, your daughter play rugby as well?
Absolutely, yes.
Ah, they do. Yourself also, have you played rugby in your younger days?
No, not me.
Didn't. Not you. You were busy nursing and then eventually becoming a leader. So at a fairly young age, you became a leader in your country. What inspired you to go into leadership, Amelia?
Wow. I think with nursing, the Chief Nursing Officer and the matron of the time asked me to become the ward manager of the surgical ward at 21 years old. Well, I think I was inspired to help patients, families, to recover faster and have better health outcomes. So I think I was inspired at a younger age to actually help population.
And you grew up very close to Viola Hospital, where you eventually ended up becoming a leader. I mean, what inspired you to go into nursing?
Wow. I used to visit the hospital. I see nurses there taking care of vulnerable people and babies and children. And my friends and I, we were so impressed. We wanted to be like them, taking care of these babies and people in suffering.
And then when you came back after graduating nursing school into your country, I mean, somebody must have seen the leadership potential in you, the matron, the Chief Nursing Officer of the hospital, and then led you onto that leadership career.
Yeah, I'm so thankful for nursing leaders at the time for putting me at the deep end of the sea to actually navigate leadership at 21 years old. And I remember I was significantly challenged when they told me, because there are senior nurses there who graduate also from overseas. much older than myself, and here I am going to lead expert nurses at the ward level. But I have been so happy with the opportunity they gave me.
Did
And
that make you nervous at the very young age that you had to lead colleagues who are more senior than you?
actually, no, I wasn't nervous at all. I was very happy and feel very honored to be given the responsibility. And I did ask them if they would be there to support me because I was very young, and they said yes, and
then
they did.
And you went very far. I mean, you went far in your own country as not only chief nursing officer, but also the first minister of health, a female minister of health in your country, and then leading the response to COVID-19 in Tonga. And you did very well in Tonga. Congratulations. I looked at the numbers of the vaccination rates in Tonga, and they are even higher than in my own country. I also led the COVID-19 response. I was proud of our vaccination rates, but you were even higher. Congratulations on that. And now you are basically the head nurse of the world, Amelia. Does that make you nervous?
Wow. I think partly it makes me nervous, but I think I was so honored. I wanted to see what ways I can help the profession to help the people of the world around the globe. So yeah, I have to learn a lot to better understand different countries, different populations and their values. Very honored.
And around the world, I would say in most countries, nurses actually occupy a lot of leadership roles in healthcare. I've seen it in my own countries. Yet they are not always recognized as such. I mean, sometimes the focus is on the medical doctors. They tend to steal the limelight. Why is that?
Wow. I come from a country where there is focus on nursing. And we have easy access to health ministers and health leaders and politicians. But of course, throughout my career, I would be the only female and younger at the policy table, and majority are male and medical profession.
But that is changing. That is certainly what I have seen in my own country and in many countries. That balance is changing. So there's a stronger empowerment of nurses, also in leadership roles. Would you not agree?
Absolutely. Of course, there is a need for more engagement and inclusion of nurses at leadership level, at executive leadership level, and also at management, and most importantly at the frontline point of care. That is very important to lead effectively for safe and quality care for the population. But no doubt it's very important to engage more nurses at the executive policy table so that they can bring in their expertise, bring in the realities of the impact of care on vulnerable communities, women, girls, and disabilities. They can bring in that wealth of experience to the policy table so we can make decisions that are fair and at the best interest of the population. Because I believe that decisions must be based on the population, must be centered on the population and what is good for them for the long term.
Sure. And as you say, I mean, often the nurses are actually the healthcare professionals who are closest to the population, closest to the communities, closest to the patients and the families. So you have that engagement. And I would imagine also, especially like in your own country with many islands and remote areas where they don't see a medical doctor and you can't provide for a medical doctor, but there's a nurse as the healthcare professional. So one of the things you have focused on in both your leadership roles, also in your current role, but also in your political role as a minister, is to improve on the professional standards of nurses. Basically creating stronger frameworks for nurses to pursue academic careers, for postgraduate studies, assuming also academic positions, and also assuming, for instance, nurse practitioner roles, etc. And I think you even, as your time as minister in Tonga, signed and introduced and signed the first act on professional standards for nurses and midwives. So congratulations on that. But why is that important? Why professional standards?
Mm-hmm. Professional standards are very important because they are to protect the public. My PhD was on professional standards, and that is a primary responsibility of a profession to be accountable to the public, to the population. So professional standards will ensure safe and quality care is consistently delivered to the population. And of course, we have the education standards of all levels of education for nurses, including advanced practice nurse and nurse practitioner. They are so important to ensure we build best and fit for purpose nurses, as some of these nurses deliver care at subnational, rural and remote contexts on their own. And they make big decisions, sometimes life-saving decisions on the spot where they work, because they work in isolations. So professional standards are very important for the profession, and it builds trust of the population in the profession, because it enhances safety, quality, and better health outcomes for the population. And it also enhances trust in the health system. You know, here are the nurses 24/7, every day, taking care of populations around the world. And there are about 29 million nurses around the globe. Population rely on them for safe and quality care. And when this is consistently delivered to the population, it will enhance their trust in the local health systems. And then we are all connected, local, regional, and global organizations.
So advancing professional standards, I mean, increasing the number of well-trained nurses and advanced nurse practitioners who can undertake a larger amount of clinical roles is basically a way of improving access to health around the world. That is basically what is in it for the country. So, for instance, a nurse in a remote area with no easy access to medical doctors or hospitals, but the nurse practitioner can even, diagnose and treat, prescribe medicines, even maybe do small surgical things, and then with the backup of a healthcare system using e-health or telemedicine, perform and make accessible more healthcare for more people. That's basically the proposition, right?
Absolutely. We have seen the clear gaps in small islands, developing states at subnational and rural contexts, whereby we have to build capabilities to be able to deliver basic and essential care at remote contexts. And nurse practitioners are best fit for those roles. And they stay at the community, they understand the values, the culture, the social and economic status of the population, and they can better serve the population.
One of the things you have done in your current role as the Chief Nursing Officer of WHO is to launch the so-called 25 by 25 campaign, which was basically working in 25 countries by the end of 2025 to increase training in basic emergency care. Can you explain that campaign and why that was important?
Very important, because evidence shows that in low and middle income countries, more than 50% of deaths can be taken care of with basic emergency care, can be better managed with basic emergency care. So things are moving on a very good pace with the global partnership together with more than 20 countries, with Acute Care Action Network. We also have a very generous donor who is supporting us with training kids that we have tested in some of the African countries. So there is a building of momentum, and very recently in the Pacific there is BEC rollout in Papua New Guinea, and a training of the trainers to be held in June this year, with engagement of 8 countries, adding to the 20 countries that our emergency care team here in HQ, who is leading the work on BEC around the world. And we also partner with the Academy, WHO Academy, who offers a hybrid course. So instead of clinicians taking 5 days out from clinical practice to undertake the course, now they can do 3 days online with the academy and 2 days hands-on with the training kids. So it's amazing work building emergency care within the health system, building resilient health system, and universal health coverage to basic emergency care from 2025 up to 2030, and hopefully towards the future, that this work will continue.
Yeah. So it sounds like that campaign has certainly been successful. So there's a shortage of healthcare personnel around the world, and also especially a shortage of nurses. If we look a little bit at the map, can we have the next photo, please? We have actually here on the map mapped the proportion of nurses per population around the world. And as you can see from that map, I mean, excluding North America, Western Europe, and Australia, New Zealand, there's a shortage of nurses. And especially, I mean, the more yellow and green it is, the bigger the shortage, or the lower the number of nurses per population. This is very much in sub-Saharan Africa and many parts of Asia and also Central America. This is even, I mean, the shortage of healthcare personnel and the shortage for nurses have been described as a public health crisis, also because we have an aging population with more disease, so there's a stronger demand for healthcare professionals, but a shortage of nurses. And one of the things that is exceedingly highlighted is the fact that nurses from many countries in the global south are recruited almost from the day they graduate from nursing schools. They are recruited for positions in North America, Western Europe, Australia, some of the countries of the Gulf, who have a shortage, and then they basically leave their countries, which is sort of increasing the inequality of health, because then they are missing in their countries of origin. So can you recognize that as a public health crisis?
Absolutely. Global inequity should concern all of us, both destination and source countries. So this is a matter that we must seriously come together, especially the source country, where there is impact on right to health from the population, and in particular the vulnerable population. we need to come together to clearly see the impact on population, because we need to build the trust of those population in us, and health organizations, and also to see ways, long-term strategies of supporting education, and supporting strengthening of health systems at the source country, where the impact is very real at the population level, in the wards, at subnational and rural contexts. When this occurred, I was reflecting on the adequate health workforce for the subnational and the rural and remote islands. It has been long-term challenges. And with this international recruitment that is not delivered according to ethical principles and principles of fairness and transparency, and the people who are affected at the heart of the decision making, and recruiters, international recruiters who may not be taking on these principles. It's very challenging.
It's very challenging, and it's sort of reinforcing many of the inequalities that is already there. So there's a shift from, for instance, skilled nurses from rural areas. They go to the capitals of the countries and the low and middle income countries, and then the best skilled nurses are then recruited even off the capitals and the big hospitals in the low and middle income countries. They're recruited to work in the high income countries. So what we just talked about previously about increasing the professional skills and the professional standards of the nursing profession, then maybe the country who's doing that is actually not benefiting, because the most skilled nurses are attracted to high income countries. So that sounds very very bad actually in the current context. But what can we do about it? You mentioned the professional standards. WHO has professional standards. How can we reinforce them?
As I said, destination and source countries must come together to have an equal dialogue on the subject matter, on the issues. And the source countries, and particularly low and middle income countries and small islands developing states, would need to explain very clearly the impact on right to health at the population and communities level. But also equally important that there should also be local leadership. There should be fair working conditions and fair salary at the local context to retain nurses for the long term to work at country level. And of course, all countries of the world, high income countries and all the 194 member states should be able to plan for their own health workforce, to be able to train adequate nurses to deliver care for their own population.
So basically, nurses and other healthcare professionals, midwives, doctors, etc., should serve the communities where they came from. That is basically the proposition, just like you did yourself. I mean, even though you had to go to a different country to train, you came back to your community and served it. But what you're saying, Amelia, is basically that then we need to strengthen also the working conditions, educational possibilities, career opportunities for nurses in their countries.
Absolutely, absolutely. So important. For me, I must work first. I must give back first to my community before seeking other opportunities outside of Tonga. So that's my primary responsibility and accountability for the population of Tonga before moving out. But of course, there are multiple factors that needs to be looked at in the country in order to retain these expert nurses who are moving out of the countries where Tonga and countries of the world have invested for many years. You're looking at more than 10 years of expertise that cannot be built,
Very easily.
quickly.
Yeah, exactly. Yeah.
So it will take time to build such expertise and competencies to care for the population. So that is why we must all come together as global health organizations and look at the situation with absolute clarity. And equity is non-negotiable.
I agree.
Yeah.
So there's currently a crisis of global health, a crisis of withdrawal of funding and also support for WHO and many other global health entities from the United States and others. And this is has been a very big donor. And this is affecting not only WHO, but many other multilateral organizations, but also very, very many health programs in the countries. Do you see this affecting nursing and what we've just discussed as well?
Wow. Despite the current situation, I am very hopeful because in 2021, the member states, the 194 member states, endorsed a resolution to strengthen nursing and midwifery, which means investments in jobs, service delivery, education, and leadership. So I am hopeful that the member states will continue to invest in WHO and also with investment in nursing.
So there's still a very big role for WHO and for multilateralism in the current crisis.
Absolutely. Very, very important that WHO continue global advocacy for nursing and midwifery because they are a big part for advancing universal health coverage, advancing equity and gender equality for everyone around the world, and especially the vulnerable population.
Thank you very much, Amelia, and thank you very much for joining me here in the studio. And thank you very much, colleagues, for watching this edition of Transforming WHO. And do stay tuned on this channel for upcoming episodes.